A lot of people assume that blurry vision is just a normal part of getting older, something you are supposed to accept and move on from. You wake up with dry, scratchy eyes, you squint at the menu across the restaurant, and everything goes fuzzy. Or headlights at night leave you blinded and uncomfortable, gripping the steering wheel a little tighter than you used to. But here is the truth. The truth most doctors never take the time to sit down and explain to you. It is not always just old age. The American Optometric Association is clear about this. Once you are past 60, your eyes become significantly more fragile. Conditions like dry eyes, cataracts, macular degeneration, or even sudden blurry vision in just one eye become far more common. And the National Eye Institute has warned that vision loss among Americans is rising faster than at any point in recorded history. What makes this especially dangerous is that the real damage often happens while you sleep. At night, when you believe your body is resting and repairing itself, your retina, the light-sensitive tissue lining the back of your eye, does not always receive the oxygen and nutrients it needs. The delicate photoreceptor cells that allow you to see clearly begin to break down slowly, silently, and most people do not notice until the damage is already done. So here is the question I hear almost every single week in my practice. Why is my vision getting blurry? And is there anything natural I can do about it without depending on expensive medications or risky surgery? Here is the honest answer. Most of the common solutions out there, eye drops, stronger glasses, even laser surgery, address the symptoms. They do not go after the root cause. And that is exactly why the vision care industry continues generating billions of dollars every year while older adults keep struggling. A study published in JAMA Ophthalmology in 2023 confirmed what many researchers had been observing for years. Age-related retinal damage often begins with silent changes deep inside the eye, oxidative stress, chronic low-grade inflammation, and these changes are most active at night, precisely when your eyes should be doing their deepest repair work. But here is the part I genuinely want you to hear. More recent research has uncovered something truly exciting. Certain everyday fruits contain powerful natural compounds that your eyes are literally craving during sleep. These nutrients can support the regeneration of damaged photoreceptor cells, improve circulation to the retina, and even slow the progression of macular degeneration, which remains the leading cause of central vision loss in adults over 60. In other words, you may be able to support clearer vision naturally, safely, and while you sleep, without reaching for another prescription bottle, without booking another surgical consultation. And the number one fruit on this list, one most people already have in their kitchen, contains a natural enzyme shown in research to interfere with one of the most destructive processes behind cloudy lenses and early cataracts. My name is Dr. Lauren Hayes, and I have spent years working with older adults who are serious about protecting and preserving their vision using evidence-informed natural approaches alongside conventional care. Today, I'm going to walk you through 7 fruits that research suggests can support overnight eye repair and exactly how to use them the right way. Before we get into it, I would love to know where you are watching from right now. Drop your city or your country in the comments below. We are building a real global community here. People who refuse to accept vision loss as something inevitable. And one more thing, genuinely important. Everything I share here is educational. It is not a substitute for professional medical advice. If you are experiencing vision changes, blurry vision, or any concerns about your eye health, please see a licensed eye care professional before making any changes to your diet, supplements, or lifestyle. Your eyes are too important to take chances with. Now let us count down from number 7. Let us start with number 7, and that is kiwi. Small, a little fuzzy, probably walked right past it at the grocery store this week. But for aging eyes, kiwi is genuinely impressive, and the research backs that up. Here is why it matters. As we get older, the retina, the part of your eye that captures incoming light and converts it into signals your brain can read, becomes increasingly vulnerable. Oxidative stress accumulates. The cells begin to wear down. Before you know it, you are squinting at road signs. Headlights look like starbursts when you drive at night, or you wake up every morning with vision that takes an hour to fully clear. That is not just aging. That is cellular damage. And there is growing evidence that it is addressable. Kiwi is loaded with 2 nutrients that eye researchers keep returning to, lutein and zeaxanthin. Think of them as natural internal filters. They sit within the layers of your retina, absorbing harmful blue light and providing antioxidant protection while your eyes move through their nighttime repair process. On top of that, Kiwi contains a unique combination of antioxidants and a small amount of serotonin, which supports deeper, more restorative sleep. And deep sleep is when your eyes perform their most important repair work. The two go together more than most people realize. The research here is meaningful. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness alongside reduced morning dryness and eye redness. 2 pieces of fruit. Measurable results. How do you use it? Keep it simple. Eat 2 golden kiwis, not green ones, about an hour before bed. Golden kiwis carry more lutein, produce less acid, and sit easier on the stomach late at night, which matters when you are trying to get quality sleep. And here is a detail most people miss completely. Do not peel all the way to the edge. That thin layer of flesh right beneath the skin contains concentrated caffeic acid, a potent antioxidant. Just scoop the fruit out with a spoon and leave that inner edge intact. Something as ordinary as a kiwi. Better night vision, less morning dryness, no pill, no procedure. Number 6 on our list is one you probably already love: watermelon. And if you have ever wondered why your vision is still blurry an hour after waking up, you will want to hear this. As we age, the eyes dry out faster. Blood flow to the retina gradually slows. And that reduced circulation is a major contributor to that frustrating morning blurriness that sometimes takes hours to clear, if it clears at all. Watermelon is over 90% water, so hydration is an obvious benefit. But the research points to something deeper. Watermelon is one of the richest dietary sources of lycopene, a powerful carotenoid antioxidant linked in observational studies to reduced oxidative damage in retinal cells and potential protective effects against age-related conditions, including cataracts and macular degeneration. Studies have also shown that people who eat watermelon regularly tend to have higher circulating levels of lutein and zeaxanthin, those same key vision nutrients we discussed with kiwi, and research indicates that certain compounds in watermelon can support nitric oxide production and improve peripheral blood flow, which could translate to better oxygen and nutrient delivery to the retina during sleep, exactly when your eyes need it most. How do you use it? Enjoy 1 to 2 cups of chilled seedless watermelon about 30 minutes before bed. Skip the salt. Added sodium can raise intraocular pressure, which the Glaucoma Research Foundation identifies as a significant and potentially irreversible risk factor for vision loss. Pro tip: do not throw away the rind. That white section near the skin contains citrulline, an amino acid that supports healthy blood vessel function and may contribute to nighttime eye nourishment. You can blend it into a smoothie or lightly pickle it if you are feeling adventurous. Coming in at number 5, and this is one most Americans have genuinely never purchased, we are talking about black currants. Tiny, deep purple, easy to overlook. But when it comes to protecting your eyes, especially in low light, black currants are quietly remarkable. Here's the specific problem they address: retinal microinflammation and reduced blood flow to the optic nerve. Over time, that chronic low-grade inflammation blurs vision, creates halos around headlights at night, and causes progressive eye strain in dim conditions. These are problems that a stronger glasses prescription simply cannot fix. What makes black currants so effective is their extraordinary anthocyanin content. Anthocyanins are the deep pigments that give these berries their color. And inside the eye, they do several things simultaneously. They calm inflammation, they support blood vessel dilation, and they help restore rhodopsin, the visual pigment responsible for your eye's ability to adjust from bright light to darkness. The clinical research here is genuinely solid. A randomized, placebo-controlled trial involving glaucoma patients found that 50 milligrams of black currant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve head and retinal areas and meaningfully slowed the progression of visual field loss compared to placebo. That is not a small finding. A separate pilot study in patients with normal tension glaucoma found that black currant anthocyanins increased retinal blood flow without affecting eye pressure and helped normalize levels of a compound involved in blood vessel constriction. This points to genuine neuroprotective potential even in people without a diagnosed eye condition. There is also growing evidence that black currant anthocyanins improve dark adaptation, the speed at which your eyes shift from bright to dim environments. For women who struggle driving at night or moving between rooms with different lighting, this is directly relevant. How do you use them? Fresh black currants are difficult to find in most grocery stores. Look for a standardized black currant anthocyanin extract, around 50 milligrams daily, taken in the evening alongside your other fruits. For better absorption, pair it with a small amount of healthy fat like a few walnuts, or a vitamin C source like a slice of orange. Nutrient synergy genuinely matters here. Number 4 is one you almost certainly already have at home: blueberries. But here is the part that surprises most people. The majority of us eat blueberries in a way that actually cancels out a significant portion of their eye protective benefits. What do blueberries target? Oxidative damage in your photoreceptors, the specialized cells in your retina that allow you to focus, distinguish fine detail, and adapt to changes in light. Years of UV exposure accumulate, your natural antioxidant defenses gradually thin, and slowly you start squinting at text, struggling in dim light, or asking yourself why your vision is blurry even with glasses on. The key compound in blueberries is pterostilbene, chemically related to resveratrol but significantly more bioavailable. Research suggests it can cross the blood-retinal barrier and act directly on DNA damage in light-sensitive cells. That is a meaningful distinction from most dietary antioxidants that never reach the tissue that actually needs them. A 2023 study published in Nutritional Neuroscience found that older adults who consumed wild blueberries daily for 12 weeks showed notable improvements in visual acuity and reported meaningfully less eye strain when viewing digital screens in low light. But here is the critical detail. Not all blueberries deliver the same benefit. The large, shiny, cultivated varieties commonly sold in supermarkets have measurably lower antioxidant density. Wild blueberries, the small dark ones typically found in the frozen section, carry nearly double the concentration of active compounds, and frozen is just as effective as fresh. How do you use them correctly? About a third of a cup of wild blueberries 45 minutes before bed. And here is the pro tip that most people get wrong. Do not combine them with dairy. The proteins in milk bind to anthocyanins and physically block absorption in the gut. Instead, lightly freeze and then thaw your blueberries before eating. That process breaks down cell walls and dramatically increases the bioavailability of the antioxidants, meaning your eyes can actually access them during overnight repair. At number 3, and this one surprises almost everybody, we are talking about dragon fruit. Exotic, visually striking, bright red inside. And research suggests it may be one of the most effective fruits for increasing oxygen delivery to your eyes during sleep. If you regularly wake up with tired, heavy eyes, even after a full night of rest, this one is worth paying close attention to. The variety matters enormously here. You want the deep red flesh. The white varieties do not contain what we are after. The specific problem dragon fruit addresses is retinal hypoxia, when your retinal tissue is not receiving adequate oxygen during sleep. When that happens, you can sleep a full 8 hours and still wake up with fatigued, heavy eyes. Your peripheral vision starts to blur, colors look flatter than they used to, and if left unaddressed over time, the cumulative damage can be significant. Red dragon fruit is rich in betalains, a class of antioxidants that research shows can support nitric oxide production in blood vessels. Nitric oxide is the molecule that relaxes and widens capillaries, including the tiny ones that supply your retina. Wider capillaries mean more oxygen and more nutrients reaching retinal tissue during deep sleep. A 2022 study published in Frontiers in Aging Biology reported that participants who consumed red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. In practical terms, they could see more clearly in low light and reported noticeable reductions in blurry vision. How do you use it? Half a red-fleshed dragon fruit about an hour before bed. And here's the pro tip that almost everyone misses. Do not swallow the black seeds whole. Chew them. Those seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and repair. Swallowed whole, you lose almost all of that benefit. Number 2 on our list, and this one has thousands of years of history behind it, is goji berries. Bright red, slightly sweet, used in traditional Chinese medicine for over 2 millennia specifically for eye health. And now the clinical evidence is beginning to align. Here is the exact problem they target: macular thinning. The macula is the central zone of your retina, responsible for the sharp, detailed vision you use to read, recognize faces, and see color with clarity. As we age, oxidative stress and reduced circulation gradually degrade this tissue. That is the foundational process behind age-related macular degeneration, one of the leading causes of irreversible vision loss in older adults worldwide. What makes goji berries exceptional is their zeaxanthin content. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. While lutein predominantly protects the outer retina, zeaxanthin concentrates specifically in the macula, your center of vision. That targeted protection matters enormously. The clinical research is compelling. A 2021 study published in Nutrients followed adults aged 60 to 80 who consumed dried goji berries 5 days a week for 90 days. Results showed a significant increase in macular pigment optical density, a direct measure of macular protection. And no participant showed further progression of macular degeneration during the trial period. For anyone concerned about losing visual independence, that finding deserves serious attention. How do you use them? Soak 2 tablespoons of dried goji berries in warm water for about 10 minutes, then eat them roughly 30 minutes before bed. Soaking softens them and improves digestibility, which matters for older digestive systems. Pro tip with genuine science behind it: pair your goji berries with a small square of high-quality dark chocolate, at least 85% cacao. The flavonoids in cocoa have been shown to enhance the absorption of zeaxanthin. Together, they create a synergy your macula can actually use. Number 1, papaya. And finally, number 1, the fruit that tops this entire list for your eyes is papaya. Not exotic, not expensive. You may actually have one on your counter right now, but when you eat it correctly, it targets one of the most destructive and most overlooked processes behind blurry vision, cloudy lenses, and early cataract formation. Here is the specific enemy papaya goes after: glycation. That is the process by which excess blood glucose binds to proteins in your eye tissue, forming advanced glycation end product compounds that progressively cloud your lens and degrade your retina. Glycation is one of the most underappreciated contributors to age-related vision deterioration, and it is happening silently and continuously in most people over 60. Papaya is rich in papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties. It also delivers a powerful combination of vitamins A, C, and E alongside folate, nutrients that research consistently links to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A 2023 study published in Clinical Gerontology found that older adults who consumed papaya in the evening showed lower levels of glycation markers in follow-up testing, alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. For women dealing with dry eyes, blurry morning vision, or early-stage cataracts, those are meaningful outcomes. How do you use it? 1 cup of ripe papaya cubes about an hour before bed. 2 things matter here: fresh is better than processed, and room temperature is better than cold. Take your papaya out of the refrigerator at least 30 to 60 minutes before eating. Cold temperatures suppress enzyme activity, and you want papain at full strength when it reaches your digestive system. Do not pair it with dairy either, for the same absorption-blocking reason we discussed with blueberries. Pro tip: squeeze fresh lime juice over your papaya before eating. The vitamin C in lime meaningfully boosts your body's absorption of vitamin A. Your eyes get more of what they need, and honestly, it tastes considerably better too. Now, before we wrap up, there are 5 rules I need you to hear, because without these, you could eat every single fruit on this list and still not get the full benefit. Rule 1: do not combine with high calcium foods. If you eat your papaya or blueberries shortly after milk, yogurt, or calcium-fortified cereal, you are actively blocking your body's absorption of lutein and zeaxanthin. Research has shown that high-calcium meals consumed alongside antioxidant-rich fruits can reduce absorption of key eye nutrients by up to 30%. Give yourself at least 90 minutes between dairy and your fruit. Treat your evening fruit as a standalone snack, not part of a larger meal. Rule 2: always add a small amount of healthy fat. Most of the key nutrients in these fruits are fat-soluble. Your body cannot fully absorb them without fat present. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado alongside your fruit can boost absorption by more than 50% according to published research. Same food, dramatically better delivery to your eyes. Rule 3: wash gently. This one surprises people. Aggressive scrubbing under hard-running water removes a significant portion of the surface antioxidants, particularly on blueberries and black currants, where the protective compounds are concentrated in and near the skin. Rinse gently under cool water, pat dry, and wash right before eating, not hours in advance. Rule 4: room temperature over cold. Refrigeration suppresses the enzyme activity in several of these fruits, most notably papain in papaya. Below a certain temperature, these enzymes lose their functional activity. Take your fruit out 30 to 60 minutes before eating and let it come to room temperature so your body can extract maximum benefit. Rule 5. Timing is everything. Eat your fruit 60 to 90 minutes before going to bed. Too early, and the nutrients are metabolized and cleared before your eyes enter their primary repair window. Too late, and active digestion disrupts the deep sleep your eyes need to actually do the work. Hit that window, and you are giving these compounds the best possible chance to deliver what the research suggests they can. So, let us bring it all together. Blurry vision is not simply an inevitable consequence of aging. It is often the result of specific, identifiable processes happening inside your eye tissue: oxidative damage, inflammation, poor circulation, glycation. And growing evidence suggests that certain fruits, eaten at the right time and in the right way, can meaningfully support your eye's natural overnight repair processes. Think about reading without squinting, driving at night without that anxious grip on the steering wheel, waking up in the morning and actually seeing clearly within minutes, looking at the people you love and seeing every detail of their face. That is what this is really about. Not just clearer vision, your independence, your confidence, your quality of life. I want to hear from you now. If your eyesight became noticeably clearer tomorrow morning, what is the very first thing you would want to look at? Your family, a sunrise, your garden? Leave your answer in the comments below. I read every single one, and I genuinely mean that. If this was helpful, please hit the like button and subscribe for more evidence-informed natural approaches to protecting your vision and your health as you age, and share this with someone over 60 in your life. You might genuinely make a difference for them. I am Dr. Lauren Hayes. Take care of your eyes. They are irreplaceable.